so I want you to break the Rotary etiquette rule of laughing out loud and giving me some kind of sign that you all are still awake and breathing. I was fortunate to meet Leland very early on, I think maybe even in the first month, and to show the maturity of a Wolverine, despite the fact that he attended Ohio State University. We still work very well together, and will probably only be at odds on the last Saturday of November during the big football game. As you can see, I'm a huge sports fan. And I really like to thank the group who sung I Feel Good during the warm-up. We were looking for a display of physical activity with the splits at the end, but nonetheless, it was enjoyable. So I've lost my clicker here. But in any event, in all seriousness, I think one of our goals, our major objectives here as a part of the Fisher team, I came and joined Mayor Fisher's team. I'm a new Louisvillian, and came and wanted to be part of such a great vision for making a healthier community. And many of you have already heard the mayor's major goals and themes. And one is to be a city of lifelong learners. Another one is to be a very compassionate city. And the third one is to be a healthier community. And that includes our physical health, mental health, emotional health, financial health, environmental health, and a host of other things. And so feeling good is something that we want many Louisvillians to be able to say. During today's presentation, I'm not going to present a tremendous amount of data because all of that information can be found on our website for those of you who want to digest it. I wanted to spend the time to be able to share with you all sort of our philosophy on public health and population health and what it is we think we can do from a very systematic or policy and program approach to improve the health of Louisville Metro. So we'll start here, we're talking about what is public health. Typically, if you survey individuals who are not in healthcare or medicine or public health, and you ask them what is public health, they tend to think about clinics that serve people who don't have insurance, being able to fight off West Nile virus, things of that nature, but they don't tend to think about zoning as a public health issue or zoning as a part of public health. Public zoning and land use was born out of public health. In the early 19th century, people were getting the same kind of diseases that animals were getting. Water wasn't clean and safe for drinking, bathing, or anything. And so as we started to create these zones where only certain animals could be in certain places and humans could be in certain places, or food preparation could occur in this place, very separate from the other bad stuff, then we really started to have some public health impact and get rid of our foodborne illnesses. We in public health have gotten back to our roots with recognizing that public health is not just the orange ball in the center, which is your local health department or your state health department. It's all of these other things like public safety, the education system, civic organizations like Rotarians. We all have a role to play in improving our communities or the public's health. Now, why do we know these things? Well, you do well to learn from the past, and you do well to review data and to see why we've arrived at certain places. Well, before, when we thought about making people healthy, we thought we just needed good doctors, nurses, dentists, places for people to go, to be checked out, and then everybody would be healthier. Well, we now, looking at a number of studies, recognize that only 20% of the population's health is based on the quality of the health care that they receive. And that includes having that access to that health care. So if you as an individual, if only 20% is about you having the best insurance coverage and having the best doctors, which Louisville has some fantastic physicians, fantastic hospitals. If you need them, this is the place you want to be in Kentucky. We have those tremendous things here, but it's not what contributes the most to the population's health. It's those other things that we talk about that we call the social determinants of health. So if you look at this pie chart, you'll be able to see the social and economic factors like poverty and educational attainment have an impact. That health behaviors, like whether or not people choose to smoke, whether or not people choose to be physically active. What is it that you put on your plate during the Rotary meal today that could have been good or bad for you? And I trust that this is the one slice of pie or cake that you will have for today, and it's totally fine. So we're not the food police, so we just want to make sure people are making healthy food choices. And then the other piece is physical environment, which we thought about earlier as being particulate matter, meaning air pollution. You hear a lot in Louisville about concerns about air and what that does to asthma rates. And I know Ted Smith was here, I think last month, and may have talked to you a little bit about the Asthmopolis project. But things like the built environment, including how we structure our roads. Are our roads safe for walkers, bikers, and drivers? Do we have facilities or do we have places where people are within a half mile of a full-scale grocery store? If they're not, they live in what we call a food desert. So all of these things help to contribute to the population's health status. So what do we do to fix it? How do we improve health? Well, this pyramid here was created by Dr. Thomas Frieden, who is currently the director of the Centers for Disease Control in Atlanta, but was previously the health commissioner for the city of New York. And they've done a lot of things there. I'm sure some of you see them in the paper. Banning the big gulp is one of the new agenda items. He's no longer there, but that culture was created in that community to be able to be very vigilant to prevent smoking in Times Square. Those are the types of things that they were really trying to do, and it's based on some research that they've done and looking at things that have been reported. And so when we're talking about improving the population's health, not how do we make LaQuandra as an individual healthier, how do we make Kathy as an individual healthier, how do we make Susan as an individual healthier, it's not those things in particular, but when we're trying to make this entire room or the entire Louisville metro population of about 740,000 people healthy, where do we need to focus our efforts to have the greatest impact? So this pyramid will show you, and it's an illustration. It doesn't project very well in large rooms like this, but there's a schematic on the far right side, for me, that shows largest impact, smallest impact. So the bottom of the pyramid is where you get your largest impact. If you do things at the bottom of the pyramid, you're going to have a higher impact at a population level than if you do things at the top of the pyramid. So let's see what's at the bottom of the pyramid. It's what we call socioeconomic factors. So things like poverty, education, poor housing. Those are the things that if we address those issues, which many people, if we said, what should we do to improve health, wouldn't traditionally think about it, we now know if we improve those things, we'll improve the health of a community. All right? The next layer up is changing the context, and we often talk about it or call it making the healthiest choice the easiest choice. Does anyone know why the table salt is iodinized? For the thyroid. All right, good. I always like one person to at least respond when I'm talking, so thank you. And it's true. Most people don't know that that was done. Why? Because back in the days when there was a lot of radiation and nuclear exposure, people were having high rates of thyroid disease. And we knew as scientists that if people had more iodine in their system, their risk of getting thyroid disease was much lower. And so the geniuses said, well, what is one thing that everyone uses? Table salt. And so they have iodinized the table salt so that now you protect your thyroid just about every time you eat without even thinking about it. The same thing is true for fluoridation of the water. Okay, so we put fluoride in the water. Kids, as long as they brush their teeth with municipal water that has fluoride in it, it reduces their risk of dental caries. So we're improving oral health on a daily basis. You don't even have to think about it. So making the healthier choice the easiest choice, really changing the context. The next level are what we call long-lasting protective interventions, and I'll give an example about immunizations here. This is a very hot topic nationally. We often have celebrities in this country who become more trusted ambassadors of health messages than those who are scientists who do this every day for a living, and that's okay. We just have to recognize that it takes three messages to overcome a negative message. So we have to do a lot more talking and getting people convinced that what we say you should do is probably a really good idea. So all of us received vaccines. Some things that are on the market now we didn't get because they just didn't exist when we were kids. Well, we all received these vaccines: measles, mumps, rubella, polio vaccine. Some of you may have never even seen these diseases or known anyone who's had them because all of us were vaccinated. And because all of us were vaccinated, every now and then when there was someone who couldn't be vaccinated because of a health condition or because of a religious reason, enough of us were immunized already, creating something called herd immunity, such that if everybody in this room were to get the flu vaccine every year and I didn't, my risk of flu would be low because all of you are protected. So even though I didn't protect myself, you all are, and I'm being covered by your herd immunity. Versus if I'm the only person who gets the vaccine and all of you don't, your risk of getting it is very high because there's more people who haven't been immunized. And so as we lose our herd immunity, we run the risk of reintroducing what we call the vaccine preventable illnesses, things that babies died from in the early 1900s that they just don't even get hospitalized for anymore, or they never even encounter. Those things are resurging in our community. And for reference, we'll talk about pertussis, which there are some states that are having outbreaks. We're seeing increased cases of pertussis in the state of Kentucky, and in the city of Louisville in particular, we are on track to have one of the highest numbers that we've had in 5 years of cases for pertussis. So it's extremely important that we don't become complacent with some of these public health interventions